I am pleased to introduce my friend and colleague, Afsana Akhter. She is the Chief Growth Officer at Kio. Afsana has over 20 years of experience across tech and digital health and has helped commercialize several innovative digital health products in the US. She is currently the Chief Growth Officer of Kio, which provides a digital therapeutic for musculoskeletal conditions. Musculoskeletal conditions are a top cost driver for U.S. employers and a leading cause for opioid use. Prior to Kio, Afsana was the Chief Commercial Officer at Prealize Health, a Stanford spinout which uses AI for early detection and intervention of serious health events. At Livongo Health, Afsana served as VP of Health Plan Strategy and Sales, where she established reimbursement pathways and brought the company's digital diabetes solution to millions of people via large health insurance companies and employers. Livongo achieved an IPO in 2019 and was acquired by Teladoc in 2020. Afsana also co-founded Skin IQ, a company that uses AI and machine vision to help people better manage their skin conditions. Afsana holds a bachelor's and master's degrees in electrical engineering and computer science from MIT, where I first met Afsana. We're pleased to have Afsana lead our second session.
Thanks so much, Professor Lin. It's my pleasure to be here, and I also very much enjoyed the session one earlier today. I wanted to just take a few minutes sharing my perspective and experience in having worked at digital health for 15 years in the for-profit sector, trying to really turn digital health companies into financially viable companies, and also trying to get those digital health solutions into the hands of the masses, primarily by commercializing them with enterprises and institutions such as employers, health insurance companies, and health systems, and trying to find reimbursement pathways. And then those institutions would in turn get the digital health solutions into the hands of patients and consumers. And it's been a very rewarding time doing that for 15 years. But what I can say is there's just such an abundance of amazing innovation already there. And I think we already know this. There's just constant investment, innovation happening, integration, and all of those things happening. But the challenges have always been, I mean, despite all of that investment and innovation, there's still there has been historically such low adoption in comparison, and the barriers that I would feel day to day were institutional barriers, they were systemic policy barriers, reimbursement barriers, as well as just the plain inertia of consumers and us as human beings, latching on to what we're familiar with. So it's been a real uphill battle for digital health in the US in so many different ways. And as Michelle said earlier, despite so much of the loss and tragedy of COVID-19, what it has done is really taken away a lot of those barriers, both at an institutional, systemic, reimbursement level, as well as at the consumer level. And it's really propelled digital health forward. We hear these stats every day, but to me, they never get old. The fact that in the US between April and July, we had 41 million telehealth claims in those 4 months. Whereas, compared to the same time last year, this represents a 4,000% growth in the use of telehealth. It's just amazing. And then during COVID, half of all primary care visits were happening over telehealth. So we really have an unprecedented opportunity here. And in our session today, we have experts, we have researchers, practicing physicians from around the globe, the US, but as also Canada, Singapore, Japan, and the UAE. And they're here to share their experiences with global innovation, as well as digital health, both from before COVID, during COVID, and their perspective on how things may pan out after COVID, which we're all looking forward to. So I'm very pleased now to welcome our keynote speaker, Mr. Steve Davis.